think we're good. Good morning, everyone. Thanks so much for joining us today on our webinar for church staffing, parish administrators, and COVID-19. We'll go ahead and get started, and I'd like to ask Bob, would you mind opening us in prayer today?
Sure, I'd be glad to. Let us pray. Oh God, we thank you for all the administrators and managers of our congregations and those in dioceses and other religious organizations who might be joining us. We pray that we will offer our best skills during this very difficult and challenging season in the life of our world and our church. We ask you to give us a great measure of forbearance and perseverance, and the level of peace and understanding, and a vision to carry our churches forward so that they might be vital voices of hope and promise in our communities. Be with us today as we talk as administrators and managers about the best way forward, choosing those avenues that bring life to our churches through Christ our Lord. Amen.
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 Thanks, Bob. Appreciate it. I just want to go around the circle really quick and do some introductions. Wajida, how about we start with you, and then we'll go to Bob, and then I'll bring us home. So tell us who you are and where you are and what you're doing.
Sure. I'm Wajida Small. I'm the Chief Human Resources Officer for Trinity Church Wall Street in New York. So I manage all of our human resources functions for about 210 folks between New York and Connecticut.
Great, thanks.
Good morning, everybody. My name is Bob Daniels, and for a long time I was the rector of a couple large churches, the last of which was St. Michael and All Angels in Dallas, and then I retired, but then didn't, and then served as an interim at St. Bartholomew's in New York City, and then at Holy Innocents in Atlanta, and then at All Saints in Beverly Hills. And now I am sort of retired. I'm still part-time at St. John's Cathedral in Jacksonville, Florida, which was original home for me. So I'm glad to join you. I've been around your circles a lot as rector of large congregations.
Thanks, Bob. Man, we've got some experts on the call today, let me tell you. I'm Karen Kraserek. I'm the Chief Administrative Officer and Minister for Stewardship at Christ Church Cathedral in Houston. Have been on staff for about 5 years, but in the parish administrator role for about 8 months. So, and just learning along with everybody else how to manage a pandemic and how to keep the teams going and day-to-day business functioning. So we're here to offer what advice and insight we can, given both history and current environments. And so hopefully we'll be able to give you guys some information to help find a path forward during this time. I'd like to start with a conversation about some staffing adjustments during COVID-19. And Wajida, I'd love to have you take that on and share what you can given your role.
Sure. So I want to address a couple of things, and I think these came from some questions you all had. So the first was around hourly staff and those that can work from home versus those that can't work from home. For us at Trinity, the vast majority of our part-time folks, which isn't a very large number compared to the number of staff that we have, we're able to effectively work from home. So they supported our communications and marketing department as well as our Sunday school. And like many of you, we've gone to remote services. So they've been able to, we've been able to secure the necessary technology to support fully remote services. So they've been able to support those, whether it's audio, visual, supporting just kind of our social media, etc. For our Sunday school folks, we've actually, along with our regular services, moved that programming online as well. And they've been able to support the online services. And we've gone to our summer programming, and again, everything is online now. So we've moved to our summer programming And as opposed to, hiring additional staff that we would normally have or have interns over the summer, we've allowed our summer school staff to support that programming as well. So they've actually been able to work more than they would have because they're working during the week now, because like most other organizations, the organizations that they worked for or would have worked for during the week are still working remote as well. So we've been pretty successful. In terms of advice, if you can find a transition or find ways in which they can support while working remotely, I think that would be a good thing. One, to continuously to keep them engaged. And two, just we all want to be able to continue to work. And when you think about things like income and hourly workers who generally don't get paid if they're not working, of course, financially, if you can support that, that's something that I would recommend. Excuse me. The other question that came up was around salaried folks, and again, working from home and online. I want to say maybe percentage-wise, maybe 15 or 20% of our workforce really have to physically be present. So we're looking at our facilities folks, we're looking at some of our programming folks for our new office, Trinity Commons, that supports community work. At least for the programming, they've been, again, able to shift to online program, not as extensive as we would if we were in a physical location, but to some extent. And our facility stuff, we have a very large building that we need to maintain, and maintaining the church. So making sure that we follow all of the appropriate guidelines, they've kind of had to go in to continue to support the maintenance of our grounds. So, the church, the building, our cemetery, et cetera. So they really haven't necessarily stopped working in terms of having to work at a physical location, because we still needed that continuous, excuse me, support.
Can I just ask you a quick question?
Sure.
So one of the things that we've been doing is, and I'm not necessarily, conditions are going to be different everywhere in every city and state. And so we've, similar to you guys, the essential staff of, at least for the building and the facility needs, are the ones that we've been trying to ensure that they can come in and do a full, work week worth of work. And then we have some other hourly staff who can't really, they're more program based, but they can't really do their work from home. And so we've made the building accessible to those people who are hourly staff, maybe not facility staff, but who are program based, who can then have a space to do their work. Are y'all doing this similarly, as far as, is that how you're trying, your ability to take some things online is to give those hourly staff who maybe don't have technology at home access to the building, or is that not an option for y'all?
It hasn't been an option, and we're in New York, and we were a hotspot for a very long time. So just the idea of literally leaving your house, it wasn't, it was a safety issue. So of course, anyone that needed to physically go into the office to do something, which was very rare, because again, when you look at percentage wise, it was only a small percentage that needed to have access to a physical location based on the work that they've done. As it relates to some of the program staff, we do have our brown bag program. And what we've been doing is what we call a big pack. So we would have folks go in once every couple of weeks to just do a major pack. And then those meals were being distributed by security at the churches, so that no one had to physically be there to support that program. So we were still able to do that. And that was one of our major physical programs, was our food program. So we've shifted. So those folks that supported the food program within the larger Commons programming, we were able to find roles that they were able to support online so that they can continue to work. But then we also did have them coming in every once in a while, along with the head of program, to do big packs. But for the most part, we just, again, when we think about how most folks get around in New York via public transportation, even though they are absolutely spotless right now, I've never seen trains as clean as they are. It was a safety issue, and the vast majority of our staff would have needed to take public transportation to come into the office.
No, makes sense. Thanks so much for that follow-up.
Mm-hmm.
Sorry, my dog has decided to join me, so I have to mute myself because he's a loud breather. So just, just know.
So the other question that came up was, okay, so it's pertaining to working these. So the idea of really not having a one size fits all. I will definitely say Trinity is a very generous organization, and we really worked hard to make sure that everyone is taken care of, again, understanding the situation in New York. So we have tried to treat everyone as fairly as possible. And one thing that came up recently when we talk about just from an HR perspective is the, performance management. We're coming up in the fall, we generally review performance, what happens to those folks that really weren't able to work because we were shut down, and how we were able to manage that to the extent that we've tried to find things where everyone can participate, but we're actually considering moving away from any kind of official performance management for this year, considering just a good number of people weren't able to do their job, and it's not their fault. So we can't sit there and say, this person did an excellent job because they were actually able to, they had to take on extra work. They had to go above and beyond because of the situation, versus this person who did not have an opportunity to really kind of showcase their performance, show that they were able to kind of really function highly within their role because they weren't allowed to come into the building and do their work. So we've Trinity is, and like most of our churches, is a family. And it's really about how are we taking care of our family now, versus, an employee-employer relationship. And for that, and for us, that's been very important. And then, so another question came up about furlough and separations. So when you think about furloughs, it's essentially kind of putting a role on hold. And a lot of organizations, both church and non-church, have had to furlough staff. I think one of the things, the important thing when you're communicating things like furloughs is not really committing, because that can be very hard. And it's difficult, and I just, from an HR perspective, wouldn't recommend you committing anything, because, your word becomes law essentially. And then of course, if you put it on paper, it really becomes law. But when you're communicating it, so there's a couple of things to consider. One, we still don't know what's going to happen. Some reports say there's going to be a surge in the fall with the flu. When you think about some other larger organizations who have already made it public that they're not having their staff come back until, mid 2021, some of us don't have the financial means to be able to do that. So it's just communicating that, they are valued. At the present time, you're not able to continue to employ them, but there's the expectation that at some point in the future, you would like to bring them back. Separations are a little different, and you want to be sure to understand the difference between the separation and the furlough. Generally, when you separate someone, there is no intention of having them come back. And again, a lot of organizations have had to let folks go, but if your operation allows, you might want to consider furloughs over separation, especially if you do have highly talented individuals that you can't keep now. You want to make sure, of course, you want to allow them to have the opportunity to find other employment if they can. But again, thinking of it in the context of making sure, regardless of the message, you want to make sure that you're letting them know that they have had value, because the relationships are important. And again, it's no fault of their own. So you just want to try to have it as positive as possible, even though it's difficult when you're telling someone they no longer have a job. But I think it's also important to make sure that everyone has a full understanding of the consideration. And of course, wherever you can make a shift, from my perspective, that's always been a practice that I like to employ.
Yeah, thanks so much for that. And then I think one thing that, I mean, have you in your conversations identified any types of additional training that can be offered to your teams or your staff to help with that kind of, what's the word, like cross repurposing or to make a shift? Is there conversations amongst the organization around that?
There have been, the most of them with the exception of, again, like facilities folks and programming folks. And when you just think of outside of having to being physically present and building relationships and talking to the community, a lot of the work that we do is administrative. So there's an ease in terms of cross administration, especially among our administrative staff and some of our junior level support staff. Again, when we think of, and I'll just focus kind of on our core programming, our Trinity Commons program, a lot of the program staff that would normally have work in the building, they're still able to kind of design programming, support current online programming that we are doing. So they still have a role. The difference is I think for a lot of people, it's the level of impact that's kind of really had the effect, less about, so we, as a part of our, I'll say, hiring process, when we're looking within teams and cross functions within the organizations, we try to look at where we can cross function, because again, sometimes another area may need support and we may say, hey, this person has the specialty, can we borrow this person? So we've been diligent around that. So kind of the cross-pollination has been relatively easy, but wherein someone needs help or support with something, just like kind of any on-the-job training, they get trained to be able to provide that necessary support. But we don't have any kind of like large cross-training programs. It's really like project-based or role-based.
Yeah, no, that's similar to what we do here. And that actually sort of leads directly into sort of what's next on the agenda. So thanks so much for your insight and your advice. Super, super helpful. So one of the next things I want to talk about, and this is directly related to what Wajida just spoke about, is sort of long-term planning for the new normal and a new budget, and understanding that these cross-functioning of staff is essential not only for day-to-day operations, especially if you have staff that get sick. How do you continue day-to-day operations knowing that somebody could be out ill for several weeks at a time, or even tending to somebody at home who might be ill? How does that not cripple day-to-day business, and how do you continue to move forward as an organization while both pastorally caring for those people, but still also trying to pastorally care for the congregation at the same time? And also knowing that what 2021 brings, not only in terms of the vaccine, but in terms of church budgets, is so undetermined right now, that as a lot of us head into the fall thinking about our annual fund campaigns, being conscious and cognizant of what does a 10%, 15% budget cut look like, and how do you build redundancies in staff, but then also how do you cross function to make sure that you have a case against laying off particular employees if you have found new work for them to do that becomes essential to your organization. So recommended to sort of look at current staff skill sets and then morph roles to meet other needs. I know, Wajida, you alluded to this. I can give an example of how we've done this similarly to you guys at Trinity with our childcare workers, right? So we anticipate that childcare, whether it's for Sunday worship or evening programming or whatever, that will be probably one of the last things that gets added back as we move through the fall. And so how do we create, viable function for those childcare workers to help not only support our business operation, but also allow them the opportunity to make some additional income? At least with childcare workers, ours are part-time, they're hourly, and so most of them have regular jobs. or day-to-day jobs. And so it was just a supplemental element for them. And so what we've done is we've crafted some roles for them on Sunday for in-person worship. Houston, we worked for several months because the cases were not as widespread as places like New York. That took a turn at the end of June. And so we actually had 2 Sundays of in-person worship. One Sunday in the middle of June with just a small test group of lay leadership, the vestry members and their families, to do a trial run of what we thought were the best safety procedures and protocols to be able to host in-person worship. And then the following Sunday, we did 3 in-person worship services using those same safety protocols and measures. And then by the next week, we had to completely shut that down due to the rise in cases. And so what we had decided is there were ways to repurpose childcare staff on Sunday for that in-person worship model, in a sense that when you have staff, you can put more stringent controls and parameters in regards to safety and security, rather than trying to utilize volunteers and have less oversight in that area. And so, creating ways for them to assist and be a part of that in-person worship protocol, and then also allowing us as an operation to break out into multiple teams. So we limited crossover of staff. So if any COVID cases became apparent in those groupings, it didn't take out the entire operation and we could repurpose. So that's one way. And then in those cases, we invited those staff, those childcare staff, to take on this new role. It was not a requirement of them. We said, hey, there's this opportunity. If you're interested, sorry, the dog is back. If you're interested in, some additional income and can work the hours that we're asking of you, we invite you to do so. Not all of them took us up on it, and that's perfectly okay. So, and in a similar vein, but not exactly the same, sorry. He was fine until 3 minutes ago. Recrafting job descriptions and roles to meet new needs. So one example that I can give is, in the time of COVID, our music department does not have as much going on as it once did. They're not hosting weekly choir practices. We have a set of staff singers who the demand is not as high. But we have our communications department, which needed some significant help when you're moving from a shift to a completely digital and virtual communications platform. And so we had an administrative level person who's was sort of 1 foot in communications, 1 foot in music, and knowing that the demand on her time in the music department was not nearly as strong as it was at one point, we've now repurposed, and she is almost completely communications, and been able to capitalize on those skill sets of hers, but also utilizing her skill sets in the music department as far as production goes in the audiovisual components of both recording worship services, making things available online. She can sort of see those things from both realms, and it's really been helpful for us to sort of improve what we've been able to provide in the digital realm. So just some creative ways to think through where can you repurpose people, which departments need more help in this time, and then which departments maybe aren't as, the demand is just not as high on the time of that administrative staff. And then I also kind of wanted to encourage people to be creative about how to repurpose in-house staff to lessen dependency on outside vendors, not only from a budget preservation, but also from a safety preservation side. The more people you have in the building, the more potential there is for the spread of COVID-19. And then there's more contact tracing that has to be done should a positive case be confirmed. And so I know we've all been sort of walking and wading into new territory in regards to audiovisual components, whether that's pre-recording worship services, shifting to a new live stream equipment, and just engaging in the digital and virtual worlds in ways that we never really anticipated before. what are ways that you can train in-house staff to do things that vendors otherwise might. So, not just in the audiovisual realm, although that's the one that comes to mind most recently, but are there things that you can do in-house that maybe you were paying someone else? So whether that's sanitation and cleaning and disinfection, potentially that's some handyman work, as far as we had some of our staff do some internal painting in the weeks in which they were allowed in the building, but business was just sort of pure essential operations. Are there things that they can do, knowing that your program schedule is not what it was, to better support your operation, but also to just help alleviate some of the strain on the budget by not having to spend all that money on those vendors. I want to just remind folks that at the end of the conversation, we'll be taking and answering questions from the chat feature. So as you have questions throughout the webinar, feel free to enter them in the chat, and then we'll get to them later on in the conversation. I do want to shift a little bit to internal communication and how it's more important than ever. Your staff are no longer in constant conversation and interaction like they were before. I'm sure, as with organizations, there was a lot of hallway chat, copy room chat, lunchtime chat, just day-to-day conversation where staff would interact with one another and conversation or collaboration would organically happen. Keeping in mind that in a virtual world, conversation is timed, planned, and interrupted in a way that it never has been before. So when you're hoping to get with a colleague and you set aside a 60-minute Zoom meeting, you're going to stick to that 60 minutes. It's not going to roll over into 2 hours like potentially a face-to-face lunch might. There's now greater demands on people's virtual time, and they're more regimented. And so just keeping that in mind and not relying on staff to convey information to one another, because it's not happening in the same way that it potentially happened previously. Communicate schedules and expectations to help alleviate both resentment and potential confusion. We're in a situation in Houston where we're doing some essential operations, and we've set in place safety protocols and procedures to allow for staff to be in the building at staggered shifts. But one thing we found early on was that if you don't communicate to staff who are working from home when certain staff are supposed to be in the building, it creates complication in processes. So that is where someone is assuming that someone in the finance office is there Monday through Friday all the time, and then it turns out that they're only in the physical office a few hours a week. That shifts the way that checks get processed, checks get cut, invoices get paid, and if you don't communicate that well to the rest of your staff, it can create a lot of confusion. Additionally, for those staff who are on site, they will go weeks or months without seeing other staff in the building or without interacting with them at all. And so how do you convey to your staff that those who are working from home are indeed working? And while it, from a macro level, of a management administrator level, it seems intuitive to us, it may not seem intuitive to the person at the hourly level when they see themselves there 40 hours a week, and then there's several offices that are sitting empty. It's not that they don't understand the COVID situation, but if their job does not translate to a work from home model, it may be difficult or challenging for them to reconcile, why their essential work is needed and the other people can work from home. So just something to consider as more folks either move towards reopening or think about reopening plans. Just the more you can communicate with your staff, the better. And then encourage and facilitate collaboration and groupthink to prevent silos. So again, staff are not seeing each other in the office all the time. and they may not be having these organic conversations. And while you're having weekly staff meetings or you're having scheduled group conversations, it you know, encouraging them to just gather and have a conversation together, even if it's just virtual, which it probably is, to help them work through ideas and challenges and struggles together. Like a couple of things that we've done is we've created a task force in regards to how to return to in-person worship. What does that look like? To bring in multiple players into the conversation, give them that buy-in, set a leadership person, somebody who's spearheading the conversation, and then everybody takes a piece of the puzzle to go and work on. So that way, you know, everyone has a hand in how decisions are made and is able to think through them in a way that a singular person couldn't take all views into consideration, but also creating team projects. So as we're moving into the fall and looking towards the fall, we've gathered a group of program staff to think through what a virtual fall launch date looks like. And then how can they get creative together in regards to identifying and facilitating different ways to engage the congregation virtually. And so it gives them a lot of buy-in. It allows them to sit and think through logistics while at the same time buoying each other's ideas. There'll be some who maybe aren't as familiar with technology, so they aren't sure about how to pursue new program options, where there's others who are wildly creative and have thought about all these different ways that they could implement new things, and getting them to work together so they're not siloed as they sort of move through their planning process. And lastly, I want to just sort of, in regards to the communication part, is conveying conditions-based timelines rather than date-specific timelines. And so the functionality there is, rather than saying, we are not going to host anything in person until December, you know, identifying some key components around the COVID-19 situation in your area and saying that these are the conditions that we're looking for before we are moving towards an in-person anything. And so there's a lot of different data out there. Each state and city is going to be different. So some of the things that we're following here in Houston is our county has a level indicator of stages of where we are within the coronavirus situation. And then we have the Texas Medical Center, who puts out daily information. And so we're in conversations about, what does condition-based look like for us? Whether it's 14 days of decreased community spread, whether it's a decrease in ICU patients with COVID, and in a lot of cases, it's multiple factors, as far as we will only meet in person if this, and this are all components of what's going on in the community. And knowing that around COVID especially, it's not going to be an overnight shift. You're looking at most likely a 14-day trend. And so it gives your staff and your congregation time to plan accordingly. You're not going to have an overnight development to move towards in-person worship. You may have an overnight development like we did, where we took a step back from in-person worship. And so when you are able to identify what those conditions are that you're willing to meet before you move to the next step in your program or your phase plans, not only does it give your congregation something to track, and so you're not having to do weekly or daily follow-up with them, but it gives your staff breathing room. So once the cases spiked in Houston and we said to the staff, we're not going to do in-person worship through the month of July, the earliest we're going to look at is August, and we'll make that decision later in the month. There was this sort of deep breath that happened that said, you know, people were allowed to take a step back and really think through the next several weeks as to how they were going to tackle projects. So, so that's sort of my recommendation, and that's going to be different for everybody. We're still moving through that, and so it's just trying to navigate that together. But not putting date-specific things on there helps to not handcuff you to the next thing. So similar to furloughs and things like that, both with in-person programming and moving through the phases of your reopening plans is really important. So I'm going to stop talking, and Bob, I'd love for you to talk to us a little bit about how can we care for our staff and for each other in this really uncertain environment.
Sure. So let me say to Wajida and to Karen, yes, they've already shared so many of the good points about looking after the management of our congregations with dexterity and flexibility and with wisdom. This all requires all of us to have some street smarts, we might call it. I mean, what we learned about managing congregations, both as clergy and laity, it's not all out the window, but certainly this new reality has just shifted so many things for all of us. So the first thing that I would say pastorally, some of these would be obvious, would be your own self-care. You as managers, as HR directors, as church administrators, I encourage you to take care of yourself. The staff will look to you and to your dean or your rector as the stable forces in the middle of shifting sand and changes week by week. It's amazing the kind of changes that we've asked our staffs to go through during the last 4 months, and we will be asking them to do that for many more months. And so if we say this is the long haul, we need for you as administrators to take care of yourself. And that means getting off of remote when you take a vacation. It really means you as administrators need to shut everything off when you take time away. I realize many of us cannot travel for a variety of reasons now. One is people who have children, they're at home and they haven't started, and maybe they're not starting school. So especially if you're in LA or a place where the school's not starting, these realities press upon you as administrators. Secondly, I would, what's obvious also is for all of you to stay very close to your dean and your rector during these months, even more than you normally do. Trust between you and your rector and dean, honest working trust is essential because you need to know what's on her or his mind and heart all the time. It used to be fairly regularly. You could sort of guess, you met up with each other, you had maybe weekly meetings, etc. But you've really got to stay in touch with your rector or your dean to know what she or he is thinking about, knowing that the rector and dean is also trying to figure this out. They did not learn this in seminary. They didn't learn this in their early parish or diocesan work. They are also trying to figure this thing out along with you. And so stay close to each other. Thirdly, what you all have already alluded to is how to love honestly with your staff, to speak clearly and honestly with consistency, so that they are not always trying to guess, and to do that regularly as administrators. That means as much as you can to check in with them individually and as groups. It means for the sextons or for the building managers who are trying to disinfect and clean the buildings, that you actually go over to the building from time to time as administrators and not just stay remote, and check in with them physically, obviously with masks and all the things we have to do, but make sure that you care about them by showing up where they're working. Contact individuals who are always remote now and offline now, not the Zoom meeting. You as administrators, check in with them on a regular basis by an email or a phone call. Remember those phone calls? And that is a little more personal rather than just Zoom. Call them up on the phone and say, this is offline, this is unofficial. I just want to see how you're doing. How are you doing? Especially those who've been repurposed. We've repurposed a lot of staff here at St. John's Cathedral in Jacksonville. I imagine a lot of you have. Our former junior choir director is now the stewardship officer. I mean, 3 months ago, she was leading choirs and playing piano for the 9 a.m. service and was a musician, only a musician. That's what she was trained to be. But we saw real evidence that she was good at details, that she really looked after a lot of important management pieces. So we moved her half-time over into a stewardship role. So we have to check in with staff members who have, especially if they've been repurposed, to find out, are they receiving what they need? Do they need to go online for any education, continuing education, or in her case, new education? How to be a stewardship officer. I've spent a lot of time with her, linking her in to SEEP webinars, for example. Another item is we've been successful on the pastoral level to let the staff know that we're planning 18 months. That is, the whole stewardship effort is an 18-month effort. The rest of the 2020, so the second half of 2020 is now linked with 2021. So in the way we're thinking about stewardship, program planning, employment plans, everything has to do with an 18-month plan, because we think at St. John's that the second half of 2020 is going to look a whole lot like the whole of 2021. We would love to be wrong. We would love for there to be a vaccine by March. We can't plan that way, though. That's wishful thinking. The science is telling us that it's going to be, I think, at least summer, if not well into 2021. So we're hedging our bets that what we are doing now is going to be for 18 more months. That has to do with employment plans. So the dean and I are working here closely on, she's not used to this, but I gave her 8 employment plans last month as sort of her older, not wiser, but older mentor on her staff. Well, she wasn't quite ready for 8 employment plans, I have to say. So that was just between the dean and me. But you all will do that with your deans and rectors. They will call upon you to ask them to give them employment plans. And I gave her 8. Well, we're working on maybe one of them right now. As I say, so that'd be for the next 18 months. I've also encouraged our stewardship planning. Our effort is going to begin the first week of August, usually begins in September or October. Why August? Because we're asking our congregation to give for 18 months. Now, let me quickly go into the details of this before my time runs out. This is very important because what stewardship is doing dramatically affects what you're doing as administrators and what the dean and rector are able to do for the 18 months. And that is, we're asking our congregation to see this as a crisis. So this is the rainy day. If you have money that's been assigned for a rainy day, I have to say to the vestry regularly here in Jacksonville, this is the rainy day. You can't come up with something more dramatic than a pandemic. Even a hurricane that's hitting South Texas or one that might hit Florida, that's not like this. So administrators, tell your vestry regularly, this is the crisis. We draw on reserve funds if you have them now. Don't wait. And also, we're asking our congregation to see this as an opportunity, even in the middle of a crisis, for them to give more during 2020. So we're calling it Pledge Plus. They're making a pledge for 2021. The plus part is they're going to add to their pledge or they're giving the 2020 if they're able to. Some have lost their jobs. Some can't even fulfill their pledge for 2020. Others can, though. They're working remotely and they're doing just fine economically. So we're calling upon those people who can to give an extra amount for 2020 and see that as an 18-month pledge. You see how this works. Pledge plus, and then we're going to do our budget earlier than we normally would do it. Most people budget in October and November for 2021. We're going to budget in early September. We've knocked that back a couple months. I would encourage you as administrators to bring everything back to the present day, at least by a couple months, so that you see things as an 18-month category.
Can I talk just for 1 second? There's a couple of questions in the chat, especially about your employment plans. And when you say 8 employment plans, you know, what exactly does that mean? Did you shift around? Is it, you know, if you can explain a little bit more of what that means, I think that'll help some folks.
Sure. So first, it begins with you and the dean or the rector and the vestry deciding on what are the essential strategic goals that you can accomplish during the next 18 months, given what we have, the reality of the pandemic. Everybody's gone virtual. We're all Zooming, etc. What are the most essential things that your congregation or your diocese needs to attempt to accomplish, given the present realities for the next 18 months? How much is that going to cost? Come up with at least a cursory budget of what your 2021 budget is going to look like. And maybe some of you have to redo your 2020 budget. We have redone our budget at St. John's Cathedral for the second half of 2020. So the other thing to remind you is a budget is not a fixed reality. It's always a roadmap. It can always be changed. Don't ever see your budget as, well, we can't do that because the budget says blank. A budget can be changed whenever the vestry decides they want to change the budget. So then come up with an employment plan or plans, plural, that then makes sense for both your strategic goals for the next 18 months and then also what your budget can handle. So what do 8 employment plans look like? Well, some of it's based on money. If we have to save this amount of money, then this would be the employment plan, given our strategic goals. If we have to save this amount of money, then this is going to be our employment plan. In other words, I've given the dean a lot of options that are going to be in front of her so that she and I and a few others can make some very thoughtful, careful decisions that are based not just month by month, but on an 18-month category. I'll give you an example. I built myself in, say, to a couple of the plans. So one of the plans would say things like, well, as the senior associate, I was 3/4 time until 2 weeks ago. One of the plans we've already worked, I moved from 3/4 time to 1/4 time. So one of the plans had me involved. So you see, we're adjusting staff on an incremental basis. She's already made one staff plan that is an adjustment, we might say. That started the first week of July when the PPP ran out. Most of us had to adjust things after the payment plan ran out. So we had to adjust our staff. There's going to be another adjustment in September. There'll be probably another adjustment in December or January. You see what I'm saying?
Yeah.
So that the employment plans are by an incremental planning, not just that there are 8 different plans, but one plan might say, well, you're going to do all of this in September. Another one would say you're going to do a portion of this in September. You're going to wait on this for January. Yeah. Does that make sense?
Yeah, absolutely.
Okay.
Absolutely. We've got about 10 minutes left. So Bob, if you've got a couple more things you want to touch on, feel free, or we can go ahead and move to questions that are in the chat just to make sure we're.
Well, I'll just touch on one more thing is the dean and I and our director of operations, who would be in the category of many of you, the 3 of us are called upon by the staff to be sort of non-anxious presence. You hear that a lot, and in family systems theory, the non-anxious presence is the person, you're one of them, whoever you are, you're one of them, who's called upon by your congregation or your diocese to be a calming agent. And our language, our voice, our demeanor, the way we express ourselves, even if we might be churning in our own gut, is to show the staff both their value, affirming them a lot more than maybe we used to say it out loud, write them an email and say, I noticed that you've done some extraordinary work. I want to underline this as administrators to be the calming agent. If you asked our staff here in Jacksonville, especially, I have to say, especially the last couple of weeks when we thought the RNC was coming here, we're 2 blocks from where Trump was supposed to speak. Mm-hmm. So we had to deal with all the stuff of what resistance was going to look like, what violence might even look like outside our doors. So it's not lost on all of us that our churches reside in very complicated neighborhoods. Kieran, you're in Houston, a very complicated downtown environment. Trinity Wall Street is obviously a very complicated part of geography. Many of us reside in very complicated and multi-dimensional neighborhoods, and our staff needs somebody to be a sure and certain voice in the middle of all of those moving parts to say, it's going to be okay, and we're going to do better than survive, okay? Keep your chin up. Almost like a cheerleader, all of us are called upon to be sort of that voice of assurance. And you know this, administrators, that goes a long way for our staff. They'll come back later and say, boy, I was really able to survive during whatever month it was because you gave me that little voice of affirmation that I received. So I know that's obvious to everybody, but I want to really underscore that all of us need to do a double dose of assurance and affirmation.
Yeah, I think that's
Yep.
So I'm looking, I want to be cognizant of our time, but also I'm looking through the chat. And so Wajida, there's actually a really pertinent one in here, the last couple we've received, that I would love to loop you in on. So there's 2, and I'm going to sort of lump them together, but what resources are you using to manage the new federal laws, including Emergency Paid Sick Leave Act, Emergency Family and Medical Leave Expansion Act, Families First, Coronavirus Response Act, and the CARES Act? And then also, are there any thoughts on loss of benefits for staff, especially around healthcare coverage, and just sort of what are your resources, and are you guys beginning that conversation, or how are you handling that?
Sure. So related to leave acts, we're definitely starting to really consider that. Some of the conversations that we start to talk about is, when does that kick in? Mm-hmm. And then what does that look like for staff? So when you think about all of these types of leaves and paid versus non-paid, you have to understand or identify what your policy states. So internally for us, we have paid leave based on certain qualifications. So even though the law might say they get 2/3, I think it's 2/3 pay for up to 12 weeks or something along those lines, because we give fully paid leave, we're going to continue to give fully paid leave because that's what our policy states that we do, as long as they've met the criteria as it comes in terms of like tenure, etc. We're still identifying when that kind of kicks off, especially when you think about the new law as it relates to childcare leave. Our interpretation is that kicks off once that person has been informed that they need to return to work. At that point, they can request the leave, and I believe it's the 12 weeks, so they get the 12 weeks. And after that, you follow any kind of leave laws when you think about like FMLA, et cetera, in terms of like job protection, et cetera. Everyone has their own practice. So the 2 main things to keep in mind is, one, what you have as a stated policy as it relates to laws and its correspondence to the laws that are being presented and what your obligation is as it relates to following the law, following your policy. Most organizations will follow their policy. So if their policy gives a fully paid leave, regardless of what the law says, they're going to give a fully paid leave. The question around benefits, that's a very difficult question. Especially for those that receive employer benefits, outside of any other general qualifications, if folks lose benefits, there really isn't anything different that can be done. We've had some folks whose spouses have lost their benefits and they've had to transition to ours. But beyond what folks can get outside of employer benefits, there really isn't anything different that can be done. That's been the main thing. I think when you think about furloughs, to some extent you can continue benefits while the person is on furlough, but again, you have to understand what your timelines are, what you are actually going to commit as it relates to the length of time that person is going to be out, because the benefits are still going to be a cost. That kind of gives them some assurance that you intend to bring them back, but again, you have to look at your budgets, you have to understand, and with that, you really, even with that, it's hard to commit, but that is actually an option.
Yeah. There's costs involved with everything, whether it's emotional or monetary.
Yeah.
There's always something. There's a lot of good questions kind of coming in. So guys, if y'all are willing, I'm willing to hang out a few more minutes after we reach that the hour mark, just to make sure that we get good coverage of some of these questions. So I'm going to scroll up to one that says, as you're looking at deploying staff in different ways, who are you bringing into these discussions? And, are you talking directly with supervisors? Are you getting pushback? I'll sort of speak from my experience that the conversation starts at the top, that the senior staff are evaluating where needs are and how can we potentially deploy resources to sort of shift things around. And then from there, it goes to the supervisor or director level to say, senior staff have identified this need. We think that your person or support staff would make a good fit, and this is what we're needing of them. And then the director going to that employee, sometimes coming from the top, and saying, these are the things we need you to do based on the current time. At least in my organization, we haven't gotten a lot of pushback. We had lots of people who were anxious to return to work in whatever capacity they could, and so have been willing to take on new skills and learn new things to try to move the ball forward for the greater good of the organization. So mostly the response has been positive. There are some concerns from some employees about returning to the physical plant due to children at home or immunocompromised family members. And so we're kind of working with those individuals to craft a plan that accommodates needs in the short term, but moves towards a longer term goal of what changes need to be made in certain areas to allow them to return to the physical plant, knowing that at some point in time, we will need them to return to work in person. Maybe not immediately, maybe not through the summer, but it will be part of the conversation. So Wajida and Bob, if y'all have additional insight on those conversations, love to have you.
Sure. So I'm going to go the opposite direction. I'm going to start with kind of like those folks that need to come back to work, and you mentioned childcare. We had that challenge with our retreat center in Connecticut. Connecticut's guidelines are a little different, so they were able to open up, and we've had some retreats booked. So all of the retreat center staff are physical location staff. We did have some staff members that did have childcare issues, so we did provide them with an accommodation in terms of a reduced schedule. They were able to work it out where they were able to come in, I believe it was like twice a week as opposed to the full 5 days a week. And since we had already established as an organization, as Trinity, for a potential soft opening or the beginning of our phase in September, that accommodation is until September. So after September, we will reevaluate it to see, does it still make sense, for us to continue to accommodate them? But it also gives them an opportunity. They've essentially 2.5 months, maybe 3 months, to figure out what their childcare situation is going to be. As it relates to kind of cross-functioning, for us, it's twofold. So we had conversations at the top, but we also had some staff reach out to some of their colleagues or just other senior leaders that they're comfortable with to say, hey, I really don't have much to do. Like, is there something that I can do? I want to contribute. And a lot of that happened with our administrative staff. And prior to all of this, we had already established kind of our administrative professionals group for cross-communication, cross-education, cross-functioning for all of our admin staff. So we've created like online groups. We have meetings like maybe once a month, once every 2 months to kind of get together. But once that started to come up, some admin staff had more work to do than others. It was senior leadership that facilitated the conversations with their supervisors to say, hey, we'd like to pull so-and-so to help this person who has, 500 people that need to be entered into the system, or supporting, this program or whatever. So they kind of they've actually been very proactive to say, hey, I want more to do. And talking to their colleagues that kind of pushed into leadership to say, hey, let's really take a look at it. We do have some staff that aren't working. People want to support each other. How can we do this cross-pollination? And then leadership facilitated that conversation with their supervisors to say, hey, we need support in this area. We understand, what so-and-so's kind of workload can they support? And it's always been absolutely.
Bob, do you have any insight from
No, what both of you are on to all of those issues. The technical side of all of what you manage is known to all of you as directors. In terms of making decisions about the staffing, I would agree with both of you that it's gone on both sides of the spectrum here at the cathedral. That is, the dean and parish administrator and myself have made some decisions about staffing, but then also some staff functions have come from the staff themselves. They've had some great ideas that they brought to us about, hey, what if we did this and the two of us could join together and get this done? As you say, Wajida, it's some of the creativity that we've discovered has come from the ingenuity of the staff and not from the top.
Yeah, absolutely. Absolutely. There were lots of questions about if return to worship plans need to be approved by the bishop. Everything I've seen in the chat says yes. I know here in the Diocese of Texas, that is, of course, the case. What about in where you guys are in Florida and New York? Did your bishop, are you in conversation with your diocesan offices about what your plans are, and do you need approval?
It's more of following the guidelines, not necessarily approval, but we've actually been much more conservative than the diocese.
Yep. Bob, how about you?
We've been on the other side. We've been our bishop has left it up to each congregation to some degree. He has set out some guidelines, but within those guidelines, there are some individual congregation decisions. So we have in-person worship still, 2 services per Sunday. They're not well attended. And of course, we all know that the severity of the guidelines of worshiping in those conditions is not very satisfying. You can't sing, you have to wear a mask, you have to 6 feet away from each other. We're actually taking communion at those 2 services carefully by individual wafers and individual paper cups. Parishioners are then invited, worshipers are invited to, as they leave the church building, the worship space to actually receive their communion on their way out of the door. They don't come forward. Some churches are having them come forward. We find it's too iffy on the movement. So it's not very satisfying, though. We have probably 30 people at the early service and 40 people at the later service. So we're not talking about big numbers. I mean, the cathedral holds 750 people here. So like Houston and New York, we have huge worship spaces and not many people who are coming. So most of it's still virtual is the answer.
Yeah, well, Bob, your dean spoke with my dean and talked about your success on the distribution of communion. And so for the 2 Sundays that we actually were able to host in person, we followed your model. So it made its way over here.
It seems to be working, but you know, I have to say it's worship in a different style, you know.
Yeah. Okay, so I'm still looking at chat. Just want to make a note to everybody that Joe has put a survey link in the chat. If you're willing and able to fill out that survey, it'll help us know how we're doing and give the SEEP network some valuable feedback on what you're looking to hear more about in the coming weeks. There's a couple questions, Wajida, about ADA. Does it kick in when employees have issues returning physically to work, and about staff with high-risk medical concerns that prevents return? Do you have any? I know it's, you know,
sure. You still have to follow the appropriate kind of steps for accommodations in this case as well, in terms of the request for accommodation. And then, so when I mentioned accommodation, it was more of for us, it was more of a choice to accommodate a shift in schedule, understanding the current circumstances. When it comes to, I will say, the official accommodations, you still have to follow the same rules in terms of whether or not it's, you know, falls within the ADA guidelines for that person. But again, you also reserve the right to just kind of make the decision on your own to allow for any changes in process or work. Just keeping in mind when it comes to something like a disability under ADA guidelines, you have to follow ADA. You have to follow ADA rules regardless. There's no kind of, in this case, kicks in or doesn't kick out. If someone requests an accommodation and it falls within ADA guidelines, you have to follow the guidelines.
Yeah.
And then you ask another question that I didn't hear.
It was staff with high-risk medical conditions that prevent them from returning. I think that's, at least for us, that's a case by case, and that
that's definitely a case by case. And again, we do have the new laws as it relates to kind of leaves for COVID-related illnesses. You still have your regular FMLA, and again, you're following, like, when you're talking about purely medical conditions, and if they fall within ADA or any other leave guidelines, you have to follow that process based on the individual's request.
Yeah, and one of the things that we've done on our, at least at the cathedral here in Houston, is building out verbiage to include based on specific point in the conversation. So when you're getting into the Family First Coronavirus Response Act and the CARES Act, you know, it's meant to allow, it's meant to alleviate relief in when you have someone who tests positive for COVID or someone in their household. And so it's more of a matter of when, not if, each of your employees is going to have that conversation with you, and just making sure that at the specific times in the conversation, you build in the information that they need. So if it's the first time that they're having that situation, you know, in addition to distributing all that information ahead of time, saying, you know, this is your first instance at this point, you know, you're covered for 14 days, but then, you know, this is going to use up that 14 days that have been allotted or at least provided. And going forward, if it happens a second time, you know, depending on if it's a personal exposure or a work exposure, we accommodate those a little bit differently as to, do you use sick time? Do you use PTO? What is your availability? So rather than having a blanket have that blanket conversation at the beginning with staff, knowing that there's components that they need to be aware of, but then building into those conversations as needs arise, kind of what to expect in the next step or in the next element, as far as, you don't need to tell everybody all the things, but as you engage with individuals, let them know what your policies are, what legal things are available to them, and what the accommodations are. So I think that covers most of our questions. I don't know if Wajida or Bob, if there's anything that you wanted to say that you haven't had the opportunity to say, let's go ahead and throw those out. Otherwise, I think we'll work towards wrapping up. So
Do the best you can.
Yeah. And you're doing great, guys.
Yeah.
I mean, nobody signed up for a pandemic in 2020. And I think that we can be there for each other, be in touch with your colleagues, and just, you're doing the best you can with the information that you have, and that is enough. So, but take care of it.
I would say we all need each other. And so insofar as the webinar is just this, it's just an hour or so, any of us are glad to be available. We all need to be friends to each other and good colleagues to each other. And there's probably been more sharing among churches and cathedrals during the last 4 months than in my whole 40 years of ordained ministry. So all that's a good thing. There are some good things that are going on. And one of them is we're building friendships around the country, around the globe, really, but around the country. And we need to keep that up. I encourage our staff to have at least 3 best practice colleagues that they call on in their area. So HR people need to have 3. All of our staff are expected to have at least 3 that they call upon regularly to be both a buddy, a support, but also they can learn and teach with each other. And I really encourage all of us to do that. Deans and rectors need to do that too, by the way, not just the lay staff. So I encourage my colleagues, deans and rectors, especially of large, complicated places, to be up with each other and learn from each other. So,
yeah, I think that's great.
Okay.
That's where the SEAT network can really come in and help with that. Get people connected, let you know who your peers are, and then be able to connect with them for sure. So,
okay.
all right, guys, thank you so much for your time and your insight and your expertise. And it's been a pleasure. So enjoy the rest of your day. And thanks everybody for tuning in. Hope we can help you again in the future.
Bye now.
Bye-bye.